Welcome to today's webinar hosted by eLotus and sponsored by Evergreen Herbs. We take pride in being your trusted source for quality CEU content. With over 20 years of experience in providing educational courses, our goal is to help you enhance your knowledge and expand your skill set. Offering an invaluable lineup of 250 speakers, 900 courses, and a staggering 3,500 hours of continuing education, we are committed to delivering the best educational experience possible. I'm Donna Chow, your host and your moderator, and I am thrilled to guide you through today's webinar. Today's class is titled 不通則痛, the Digestive Qi Flow for Restoring Health, presented by Dr. David Soul. This webinar is part of our series of new herbal CEU webinars for the year. Chinese herbal medicine often doesn't receive the attention it deserves in TCM healthcare. Therefore, we hope that webinars like this will help both experienced herbal professionals in honing their skills and beginners embarking on their professional journey. Today's webinar is unique as we have 3 distinct groups joining us. Our first one is our Watch It Free group, who have gained complimentary access to today's webinar using a special code. However, if you belong to this group, you don't have access to the video replay or CEUs. But don't worry, you can upgrade to our second group, and our second group is our paid group. And our paid group, you can rewatch today's webinar multiple times over the next month and earn CEUs as well. Lastly, our third group is our Gold Pass group. Our Gold Pass members get to enjoy full access to our live webinars and distant learning courses, as well as access to our library of over 3,000 hours of clinically relevant videos and articles to make you a more proficient practitioner. This membership is for 1 year, and you are entitled to a gift voucher as well from our sponsor, Evergreen Herbs, for the amount that you paid. And today, Evergreen Herbs is running a special for the Gold Pass. For everyone who is here today, the Gold Pass is $999 instead of the regular $1,500. And you receive a $999 gift voucher from Evergreen Herbs for their best line of products, the Evergreen Collection formulas, in which Dr. Soul will be talking about today. I will provide you guys with further information later today and also post a special link for you in the chat room. All right, so today's webinar will run from 10 to 2 p.m. Pacific time with 1 break. Before we begin, let me highlight some important Zoom features. First, we have the chat room. It's an excellent tool to connect with your fellow colleagues, so I encourage you to set your chat preference to everyone so that everyone can be part of the conversation. And secondly, our Q&A box is where you can ask questions to Dr. Soul. So please feel free to utilize this when you have a question directly for him. We do ask that you limit your questions to relevant topics to ensure today's webinar is very organized and efficient for everyone. Lastly, for those eligible, the CEU quiz will be available on the following workday, and I will send an email when that's ready. A little bit about our speaker, Dr. Soul. Dr. David Soul possesses a unique cultural and medical background as a Chinese American. Dr. Soul is a physician trained in both TCM and conventional Western medicine. With decades of experience treating over 100 patients daily as a single provider, his clinic has helped numerous individuals restore their optimal health through effective treatments and efficient clinical protocols. Now let's dive into today's webinar and discover something new. Dr. Soul, we are excited to see what you have in store for us. So let's go ahead and we invite you to share your presentation. Let's get started, guys.
Thank you very much, Donna. Can everyone hear me okay? And if you cannot hear me, okay. Everything's good?
Look good.
Okay. Thank you, Sam. I want to first give my sincerest gratitude to Evergreen for providing exceptional quality herbs in the United States. And I'm very selective in what I picked in our clinic. I'm very analytical when it comes to selections, whether it's herbs or whatever we bring into the clinic. So today, we'll be using the slides, and I'll be posting that here. And also, I'll be writing a lot of stuff on this side. And if you have any questions, please feel free to ask. I personally, I'm not used to sitting in front of a screen doing a lecture, so we do have live audiences here. So there'll be interaction. I like to interact. That will help me understand where you are. I don't want to lose you along the way. And so this is very important for us, the digestion. Let's see. Okay. My passion, let's start from that point. What is my passion? My passion in life is life itself. And so what is life? Is life very important? It's extremely important. And interesting, as I'm talking now about life, my own dad, my own father is in ICU, getting transferred to the end stage of his life. And so how important is life? And we'll talk about that. And so life, that's how I define life. L-I-F-E, love in full emotion. So love, therefore, is a key ingredient to health. You have to care. You have to care. When a person comes to you and sits in front of you, and it's what I tell my staff, every single person that walks in the room, you treat him or her like your own mother, father, brother, or sister, and nothing less. Truly care for them, because people don't care how much you know until they know how much you care. So the caring is a starting point. And since we're all healthcare providers, we're going to talk about what health is and how can you care for health. Okay, we'll start with a case study. Let's jump right in. Persistent cough. And I'll read it. A 62-year-old female complains about her persistent cough that are worsened during allergy season and also in the morning. She frequently catches cold as a cold with the latest episode of a respiratory infection. The lung issue was resolved with a 10-day course of antibiotics. Her cough started 3 years ago and gotten worse with lung infection 3 months ago. And now the persistent cough is non-productive. On occasion, she's unable to swallow due to her constriction in her throat and around the chest. She had 3 pregnancies with 2 live births, which both contributed in indigestion. During the time, she had appendectomy at age 17. She was diagnosed with GERD and H. pylori overgrowth, but now is a non-issue after triple antibiotic treatment. And sometimes she noticed darker stool. She has normal bowel movement and regular once a day. She experienced low back pain in the lumbar frequently, but relieved with NSAID. Her energy is low, and in the afternoon, even though she is sleeping 7 to 8 hours per night, her recent lab indicates that her iron is low in spite of regular intake of iron supplements. Her osteopenia is now becoming osteoporotic. Interesting. So we're going to talk about the respiratory, right? Actually, no, maybe. We'll talk about it. Okay, I want to keep this in mind. I want you to keep this in mind as we go through this process. Because a lot of time, we tend to focus on one system, and yet the issue is coming from another system. And before we go any further, I want to make some disclaimer first. And one is my writing. My writing used to be really good before medical school, but it changed after medical school. And especially when I talk, my writing may not be the best. So if you cannot read my writing, don't hesitate to type in the box. And my assistant here will let me know, and I'll clarify. Okay, let's get started. And also, I don't typically like holding for the bathroom breaks. I did a training in that during residency, and we had to hold for a long time. I don't like that. It's really not good because it increases the chance of UTI. And I do drink a lot of water, and we'll get into water as well. And so when I do have to go, give me a few minutes, and then I'll go. Okay, and keep this in mind, and we'll come back and discuss the case. So now let's talk about a few things. you're a healthcare provider. So the focus is actually health, not sickness. And understand the difference of health care. First, you have the care. Second, you have to know what health is. So I'm going to talk about health a little bit. So what is health? At the time of birth, we all have high function, anywhere between 95 to 100%, depending on the individual. Over time, that does decrease. And once you hit 60 to 70%, that's when you start experiencing major symptoms. Do we go from here to here overnight? No, it happened gradually. But one thing we love to do is we like to ignore it. In what way? Well, you'll go away, hopefully. You'll get better, maybe. And a lot of times we just ignore it. And when you ignore it, and by the time you get to the major symptoms, and you're doing things just to take care of the symptoms, you actually get better. If you just managing the symptoms. No, and I give you many instances where if you just manage the symptom continues. And not only continues, it actually gets worse. On the other hand, if we focus on this, on the function, so this part is called the sick care because you're focused on the sickness. And if you just focus on sickness continues. So instead of doing that, let's focus on the function. How can we improve the function, restore function to be more than 85%? And we start doing that, health starts to return. And that becomes a true paradigm of healthcare. Are you taking care of the sickness or are you restoring health? And we all know the current, which one is more predominant. And all of us, we're seeking answer to health. And that's very important. But to know health, we have to know what health is. What is optimal health? I lecture medical doctors, medical care providers, and I ask that very question, what is health? And often they will define it based on the sickness, based on the symptoms. Can you use symptoms to describe health? No. You have to use function to describe health. Symptom at best can only give you the parameter for the sickness. And then we do everything to manage to keep it within that parameter. Well, is that the best approach? And you all know the answer. Of course, you want to restore health. You want to get up in the morning, you have good energy, you're ready to go, had a good night's sleep and no pain, and everything is wonderful. So let's talk about one key word. The entire Chinese medicine, including health, change them. And that word is flow. And yes, that's from 黄帝内经. And 不通则痛 has to do with the flow. And you all heard that term, 不通则痛. When there's no flow, therefore pain. And so pain is an indicator of the beginning stage of inflammation. Yes. And you already know the 4 signs of inflammation, right? And first one is pain. Redness. Swelling. Well, we have live audience here. I'm trying to get the answer. Swelling, and one more. Heat. So those are 4 signs of acute inflammation. Now we'll go in further and talk about what is acute versus chronic. You have to very closely differentiate the two. Here's the reason why. When an area has acute inflammation, you try to do anything there, whether it's acupuncture, acupressure, massage, or whatever it is. Can you make it worse? And the answer is yes. I think we all experience that. It's actually contraindicated when an area has a lot of acute inflammation. So you have to be able to differentiate acute inflammation from the chronic inflammation. If you're not able to distinguish the two, and someone has acute inflammation, you put needle in there, it's like putting fuel into the fire. You're gonna make it worse. So we're gonna use this point initially to take down the inflammation first while increase the circulation. And once you do that, then of course, you can slowly improve the circulation, take out inflammation, and get to a point where you can go in locally to treat the area. And so that's very important. 正气 and 邪气, and I know we translate it differently, right? 正气, a lot of time you hear the term upright qi. I prefer a different term. Oh, this is a presentation outline. This is a general outline. So we'll get into more detail what each one is. And at the end, we'll have Q&A. However, along the way, I will ask if you have any questions. And if you have questions, please type it out. Because sometimes the moment of explaining it is in that moment. I want to explain in that moment. And so today, I want to focus on not on the theoretical. So there are two types of lectures. You have the theoretical, those are classroom learning, and there's clinical. This will be based on the clinical, and not just clinical, but actually clinical pertaining to the patients. When you're talking to a patient, you want to talk over the head? Of course not. Don't use medical jargon. When we talk about qi and blood and all that, yin and yang, do people understand? Most of the time they don't. If they do, great, then you can talk about it. Don't talk over the head. And also, do you want to talk to the head? No, don't talk to the head. And don't talk to the hand. You always want to talk to the heart. Always talk to the heart. And to talk to the heart, you have to listen for their heart. What matters to them? If you want to care for them, don't care just for the person. Care for the heart. Focus on the heart. And whatever action that follows will support that heart. Make it matter. Make it matter. And that flow is very important. It's not only flow of the body, but for us, the flow of the clinic as well. Yes, it doesn't seem like it's possible to see that many patients, but we do. Yesterday, we were 110 on schedule. How do you do that without compromising the care? Our care is exceptional. And that's because of flow. We're able to create a flow. And if there's opportunity in the future, we can also talk about how to manage the flow within the clinic. And we can talk about it as well. Okay, any questions so far? This is just the introduction. Okay, so let's talk about some of the general terms of 正气, and I'm going to make the bridge between the Chinese medicine and the Western medicine, and the understanding of both. If you want the Western providers to connect with you and refer you patients, you want to talk to them, not talk about things that they don't understand. So you have to understand their lingo. So I'm going to make that bridge. So 正气, a lot of times we refer to as upright qi. I call it the constitutional qi. I don't use the word qi, I just use constitution. So I use the term constitution. It's someone's constitution. And yin qi, second tone, yin qi is nutrition. Has to do with the nutrition. You can call it digestive qi. And the split stomach, I'm going to call it pancreas stomach. There's a mistranslation along the way by missionaries in China. So the word was mistranslated. And also, I won't get into detail right now, but it's more of the pancreas when we refer to spleen. And wei qi has to do with the immune, protective qi. I know that's the common translation. And definitely xie qi, what's the one we use? Evil qi. Try to use that term with medical doctors or Western care providers. They wouldn't understand what you're talking about. So I call it the pathogenic qi. In general, I just call it pathogen. Now let's talk about a general concept first. I know today is about digestion, but I want you to have a good understanding of what Chinese medicine is. And you already know, but we're going to make this even simpler. And this is how I explain to the patients. So a lot of times, a lot of things I'm talking about today is how I talk to patients. So there are two aspects. Health has to do with constitution. And on the other side is a pathogen. And imagine you have two armies. And this side, you only have 400, you have 400 soldiers. And this side, wait, I have it backwards. Okay. It's okay. We'll do it as a 400 soldiers here. And you have 200 here. And when you go to battle, who's going to win? Of course, the pathogen. And on the other hand, 400 here and 400 here, exact same number. But then you have 2,000 over here. And they go into battle. Who's going to win? Of course, Constitution. Pathogen, they're not going away. And COVID, is it going away? Well, there was COVID before COVID-19. COVID was already here before 19. Is it going away? No, there will always be COVID. But more importantly, how can you improve this? And if you're interested, during the time of pandemic, we did exceptional for our patients because we use the Chinese herbs. And there are a lot of herbs that we use. Interestingly, I found them on NIH website. There's actually research supporting it that it actually blocks the COVID, whether it is in the attachment or replication. They know specifically mechanism for that herb. And I have the list of that herbs and how I use it. And for every single patient we have during the time of pandemic, we gave all herbs, myself included. And knock on wood, it came out well. Okay, so the Constitution. And you'll see that you want to improve the Constitution. And that's the key. The focus is on health, not sickness. And that's a good understanding. And when I talk to patients this way, they will understand, oh yeah, I want to boost my immune. Well, it's more than your immune system. It's every single system in your body, including immune, cardiovascular, digestive, every single system in your body, and how well they work together. And so that's very important. You want to make sure you boost your immune or constitution. And then we'll get into how can we measure the constitution of that true health. Okay, go to the next one. And that's the constitution versus pathogen. Symptoms versus disease. And that's very important. A lot of time, what we think is the disease or the diagnosis in Western medicine, to me, is still symptoms. And when it's still symptoms, and you're treating that, you're still only treating the symptoms. And a good example I give is, if there's a crack on the wall due to the foundation, and you patch the crack, what's going to happen? It's going to crack again. And you patch it again, and again, and again. It doesn't matter how you patch it. You can use a medication. You can use acupuncture to patch it. You can use herbs to patch it. Let's get to the foundation. Fundamentally, there's an underlying issue that we have to understand what that is. And the 标原本, and that's the symptoms and the root. When do you treat what? And that you have to understand. Maybe in the future, we can have a lecture specifically on just the understanding and the approach. Today, our focus is more on the digestion. So energy and wellness. One way to gauge someone's energy, this is interesting. When I was in Florida, in AIDS clinic, it's actually a pain clinic, but we see our AIDS patient, and this is an interesting phenomenon. When someone comes in, and because they're taking medication and they have AIDS quotation, we have to check their blood constantly. We have to monitor them. And this is an interesting phenomenon is that when someone is getting worse and the lab is good, which one's gonna follow? Which one leads is how they feel. And even if the numbers are bad and they're feeling good, what's gonna follow? The labs. That's always the case. And you know that. Before you get sick, how do you feel? before you have any symptoms, how do you feel? You feel good? No. Your energy is already impacted. And so we're going to use that energy and the understanding of the energy and the flow to talk about everything. When something's blocked, it's a beginning stage of disease or disorder. And what do you know that? 4 symptoms, right? That we see. The 4 signatures. And they are? Yes. Pain. Swelling. Redness. Heat. Thank you very much. I like interaction, otherwise very boring. Okay, so pathogens of every disease is inflammation. And if you look for any special mark, pay more attention to it. You may need it later. Okay, any questions? No. So 3 key factors to optimal health. It is that simple, only 3. Don't complicate it, only 3. First, you have to give a body what it needs, whether it's water, oxygen, or nutrition. That's it. Second, not only give the body what it needs, you have to deliver it to the site of repair, location of damage. Doesn't mean what you put in. If an area is blocked, what happens? Then that area will always be compromised. Doesn't mean what you put into the body. So that delivery system, so give a body what it needs, deliver it, and third, give it time to do repair. And when does that occur? In the sleep. And we can put that on the side. If we have time, we'll come back and talk about sleep a little more. If you like, we'll talk about stages of sleep. But yes, it is a theta state based on the electroencephalogram, the EEG. We put it into different stages. Okay, since I'm talking about it, let's talk about it. So we sleep in cycles, and each night we have easily 3 to 6 cycles. 3 is minimum, 4, at least 4 is ideal. And each cycle is anywhere between 1.5 to 2.5 hours. And each cycle will get progressively shorter. And in that cycle, you have stages. So you have beta, alpha, theta, and delta. Theta and delta is your deep sleep. And in that deep sleep, that's when rejuvenation occurs, or cell regeneration, also the repair occurs in the theta and delta. And so it is the theta phase. And there's things that we do to prepare patients to go to sleep as well. And we can talk about how do we do things to moderate sleep. And so in short, there's a sleep cycle. Sleep is huge. It's huge. Sometimes it's internal issues, sometimes external issues. Okay, speak up. Can you hear me better? Yes? Okay. Someone is saying to speak up. I will speak up, and thank you for letting me know. So you want to make sure that you end up in the cycle when you wake up. So you have to know your sleep cycle in order to know when to wake up. There are times that you wake up in the middle of you go to nap and you end up going to the deep sleep, and you wake up and you're very disoriented. That's because you woke up down here. And so how can you know your sleep cycle and wake up at the end of the cycle? And we can talk about that. Today we're talking about another topic. Okay, so far so good. So only 3 things: give a body what it needs, deliver it, give it time to do repair. Imagine in 7 years, every single cell in your body is replaced by another cell. And in 1 year, close to 90% are replaced. What if we can replace it with healthy cells? How would you feel? And that's the amazing part. It's those 3 key components: give a body what it needs, deliver it, give it time to do repair. And today, we're mainly going to focus on give the body what it needs. These are things that we put through this orifice. Okay, in circulation, we talked about that. So what does the body need as raw material? Water, of course. And we'll get into detail what kind of water. Are all water the same? Of course not. So look into your toilet water and your tap water. They look very different. And we're going to understand what's the purpose of the water and what kind of water is ideal for the body. And in nature, what kind of water. And we'll also get into nutrition a little bit. And then the Wei Qi, the oxygen, since today is not about the respiratory system, there is a breathing exercise I highly recommend, and that's a Wim Hof. And I'll get into detail in the future when we have the opportunity. And I'll explain why that's going to impact the respiratory system as well as circulatory system. Most of breathing exercise focus on holding your breath after inhalation. This one is focusing on holding your breath on exhalation for one main reason, is to create negative pressure. And we'll get into detail more in the future when I have opportunity to talk about that. So let's talk about flow a little bit. In physical world, what allows flow? In human body, what allows flow? I just gave you one answer, negative pressure. So it's a pressure differential. So it's positive and negative pressure. And we can talk about that in the future. So the pressure differential is one of them. We don't really see that in the digestive system as much to maintain the flow. So what allows the flow in the digestive system? So once there's a membrane, it's the differential in the gradients, right? The osmolarity. And that's going to allow flow to go one direction versus the other. So that's one of the key components, yes. And the other one is muscle. What kind of muscle? A little review. Yes, we have 3 muscles in the body: skeletal, cardiac, and smooth muscle. So in all the digestive tract has to do with the smooth muscles. And on a side note, because this pertains to a lot of people, blood pressure. Blood pressure, if you look at every medication that's regulating blood pressure, is working on premises of pushing the fluid out of the body to give you the illusion of a low blood pressure. Are we treating the root? No. And that's what all the hypertensive medication is working on. So think of it, if you have a PVC pipe versus a garden hose, which one's going to do this better? Of course, garden hose. And that garden hose has to do with the muscular layer around the endothelium. So how can we relax the endothelium to allow the flow of the circulation? Do we take blood pressure at the clinic? We do. Why? Because every time we see a drop in the blood pressure, every single time. That's the first indication, meaning that you have to make sure that flow is in place. And you want to make sure that not only a flow in place, so you can deliver the nutrients to different areas and also carry out the toxin. Is that simple? It is that simple. Give a body what it needs, deliver it, give it time to